Okay, hi, this is the continuation of just basically the end of chapter 12 here. So we're starting off with discussing the epidemiology, if I could say that word. I don't know why it's so hard for me to say, of cancer and how factors like age, gender, race, and geographic location all affect the incidence of different cancers, right? So what we talked about before, the last thing we talked about, and again, some of this was kind of rushed at the end of class, was just talking about some common sites for where cancer is spread to. So if you're talking about breast cancer, it has the tendency to metastasize into specific kind of regions or sort of common areas. Same thing with colon cancer. It will have the tendency to go to certain areas. So it's definitely important to be familiar with some of these, and some of it kind of makes sense based on anatomy, right? And sort of, and also obviously physiology of those organs. Okay, so the next part talks about epidemiology, as I said. And so, like I said, I think I pretty much ended on this. So leading cause of death in economically developed countries, right? But you don't see, it's not the leading cause of death in developing countries. There are, in terms of contributing factors believed to be associated with it, aging, that there are, I guess, the sort of baby boomers and this large population of people that are getting older, lifestyle choices, obviously smoking, physical inactivity, eating a westernized diet is believed to be, a contributing factor to why we see it in economically developed countries, and we don't see it, it's not as prevalent in developing countries. So cancer causes about 1 in 4 deaths in the United States. The most common cause of, or the most common cancer or cancer-related death is lung cancer. And often lung cancer is associated with smoking, obviously something that's preventable, right? If we talk about gender and ethnic differences, breast cancer for all races is the most common cancer among women, and prostate cancer the most common cancer among men. Okay, Black men apparently have the highest cancer incidence and death rates, while Asian and Pacific Islander have the lowest rates. Okay, so these are some, gender and ethnic differences that you can kind of think about and think about why these things may be true. Okay. Okay, so cancer with the highest death rate for males and females is lung cancer. We kind of said that in that last slide before. In terms of, cancers that might predominantly affect children, right? So leukemias, most commonly diagnosed in childhood, and they are the most common cancer-related death among children and adults actually younger than 39. Okay, so I guess if you're, one of the more common cancers that happen to the younger population are leukemias. Okay. In terms of geographic location, infection plays a role, right? So I'm sure you guys have heard of HPV, right? Human papillomavirus, and that you can get an HPV vaccine, right? And that virus can actually cause cancer. And so there are several types of viruses that can cause certain cancers. And again, they're sort of specific in terms of what kind of cancers they cause. If you look at this is showing you incidence and mortality rates in different areas, right? And also denoting whether it's highly developed or less developed. And you can see that there are much lower number of incidents in these less developed areas versus the high developed areas. And again, you can think about why this might be true. And a lot of it probably has to do with lifestyle choices. Okay, some clinical manifestations commonly associated with different forms of cancer. So so again, common clinical manifestations of cancer in terms of symptoms and things like that. And so there's an acronym called CAUTION that was developed by the American Cancer Society, and basically to sort of remember or describe some common symptoms of cancer. So C, change in bowel or bladder habits. A sore that doesn't heal, unusual bleeding, thickening or a lump, right, in the breast or anywhere else. Indigestion or difficulty swallowing, an obvious change in a mole if you're talking about skin cancer, and a nagging cough or hoarseness, probably predominantly pertaining to lung cancer. Okay, so these are all things that are unusual for you and may indicate that you might want to get, checked out. In terms of childhood cancers, so if you think of the acronym childhood cancer, here's an acronym that might help describe some symptoms in childhood cancers, right? So continued unexplained weight loss. Where we got here? I don't know where. Oh, sorry. So the constant infections is part of the cancer part over here. So continued unexplained weight loss, headaches with early morning vomiting, increased swelling or pain in the joints, legs, backs, or bone. Again, we said that most childhood cancers are leukemias, right? So most of these symptoms have to do with leukemia type of symptoms. A lump or a mass, development of excessive bleeding or bruising, hard time sleeping, due to pain, obvious paleness, occurs suddenly, right, and persists. So it is something that just kind of shows up and doesn't really go away. And also other diseases that they might be developing or illnesses that are uncommon. And then over here for the cancer, constant, right, doesn't go away. It's constant. Whitish color behind the pupil, nausea or vomiting, constant fatigue, eye and vision changes. Anyway, you can kind of read along here. And so, again, like I said, most of these are pertaining to leukemias. Okay, so if you talk about local and systemic effects, obviously local effects are linked to where the tumor is, right? And what tissue is the sort of source of the tumor. Again, if that tumor gets large enough in size and it exerts pressure on surrounding tissues, surrounding cells, what have you, it then may cause some pain or cause a modification of function, right? So it says lung cancer may grow and block the bronchus. So if you have a mass that's blocking the bronchus, you're going to obviously not be able to breathe too well, and you would have shortness of breath. If you talk about systemic effects, primarily due to cytokines that are secreted by the tumor. So we've talked about cytokines several times, right? These are inflammatory mediators. And again, these tumor cells are going to be secreting these, and this is just going to lead to a general increase in inflammation, okay? And so that's what this is telling you here. So obviously, I mean, I guess if you have an increased amount of inflammation in general, can lead to cell death in other areas and, again, cause other types of problems. Okay, so this is kind of describing a name, right, a syndrome, paraneoplastic syndrome. So conditions that really are associated with an individual that has cancer. And so a lot of these are the sort of first indication that the individual has an undiagnosed cancer, right? So if you kind of talk about it being divided into different types. So endocrine, you may find Cushing syndrome, where you have this increase in cortisol that's released. And this is due to there's a tumor that's secreting too much ACTH, okay? So this is sort of this again, sort of secondary type of syndrome that's caused by a cancer. Hematologic, right? So involving the blood, you may see anemia, leukocytosis. All these are describing changes in blood cell counts, particularly white blood cells here, and also other types of issues with the blood. Okay, dermatologic, cutaneous issues like itching, flushing. These are all signs or sort of parts of these sort of syndromes that might arise from a cancer. Neurologic, peripheral neuropathy, where you're having this sort of peripheral type of pain that you don't really know where it's coming from. Bilateral leg and arm ataxia, so this sort of disorganized type of movement, dementia, and things like that, okay? So again, as a clinician, it's important to realize that if a patient is experiencing some of these things, it's important to think about, that cancer could potentially be a cause, right? So then it would be important to dig a little bit deeper in asking about other symptoms and lifestyle and all these different things that that could, you know, potentially put that person at a higher risk for cancer. Family history, right? All of these things. Okay, so pathophysiology of cancer and different treatment modalities, right? So important to kind of talk about different types of treatment and how they work. So first one, tumor markers, biopsies, histologic findings. So there are molecules that circulate in the blood, the urine, or other bodily fluids that may indicate a change in the status of that tumor growth. So without having to go and look at the actual tumor cells themselves, you can look for markers in the blood. And so I guess this is mostly used as a sort of comparison after diagnosis in the treatment of cancer, right? So there might be a certain marker that they're sort of using to indicate or sort of, you know, measure the effectiveness of that treatment. Obviously, this wouldn't be the only type of, you know, measurement you would be using. If you talk about biopsy, you've probably all heard the word before, but basically you're extracting a tissue sample, okay, and you're putting it on a slide and you're looking at those cells to see if they look like cancer cells, okay? And there are different types of biopsies depending on where that tumor is and what type of tissue. PET scans are basically where it's an imaging technique, right? And you're going to inject a radio-labeled glucose, and you can then look to see where you have an increase in metabolism. So you would have an increase in metabolism, increased glucose uptake in areas where there are cancer cells, okay? And so you could see where these metastatic lesions might be with that PET scan. Again, imaging technique. CT imaging as well, and you can look at body organs with the X-ray, and if you use contrast, you can see these tumors and can distinguish sometimes between benign and malignant. Obviously, surgery, we know what surgery is. You're going to basically, I mean, it can be used for diagnosis if necessary, but also to get rid of that tumor, right? All right. Also, a lot of times, right, you'll combine surgery with other types of non-surgical interventions. This is what this is saying here, right, like chemotherapy or radiation, right? So you may do both. And again, I'm sure we've all heard examples of this. Radiation, localized cancers, okay? So again, this is it's high levels of radiation, but in a focused area, focused directly where that tumor is, where those cancer cells are. So it's going to kill those cancer cells and shrink those tumors. It's not something that you're going to have, you know, this whole body exposure to, because it will kill other cells as well. Okay, so it has to be super focused. Chemotherapy, again, we've heard of all these things before. One second. All right, so chemotherapy, like I said, we've heard of this before. This is pharmacologic. Radiation, not pharmacologic. It's actually ionizing radiation that's localized. Sorry about that. So like I said, chemotherapy, we've all heard of it before. Pharmacologic treatment for cancer. Again, it's going to target rapidly dividing cells. And those that are rapidly dividing, if you have cancer, are those cancer cells, right? So this rapidly proliferating or rapidly dividing cells. Most will target cell cycle, right? Or specific phases in the cell cycle. We talked about the cell cycle before, okay? Again, these cannot selectively target cancer cells. It selectively targets rapidly proliferating cells. So if there are normally some cells in your body that do proliferate more often than others, and these would be affected, okay? And so again, that's why you get loss of hair because of that. As you can see, hair follicles, nausea, things like that, because of the GI tract loss of those cells as well, okay? You know, white blood cells, right? You have you're an increase of, or more susceptible to infection, right? Because you have a decrease in blood cells, particularly white blood cells, okay? It says treatment of choice for hematopoietic malignancies, again, these blood cancers, and solid tumors that have spread, okay? Beyond those borders of the tissue origin. So if you just have one, you know, a localized tumor that hasn't really metastasized, probably radiation is going to be the way to go. Sometimes it's radiation and also chemotherapy, right? But chemotherapy, again, is this whole body treatment where radiation is much more focused. So radiation is not going to be effective against a blood cancer, right? It's more radiation is more effective, you know, on a sort of solid tumor focused area. Okay, here are some examples of chemotherapy, you know, agents. Okay, and so you can see what the mechanism of action of each one of these is. Again, you know, it says cell cycle non-specific. This one's cell cycle specific, meaning it's going to affect S phase, right, and inhibit DNA synthesis. If the DNA is not able to be replicated, right, in that S phase, then the cell's not going to go on to divide. Okay, again, you can see all of these are affecting the cell cycle in some way. Here, these plant alkaloids will affect the formation of the mitotic spindle. Okay, so again, in mitosis, cell division is mitosis. If you interfere with mitosis, the cell can't divide. Okay, and so this topoisomerase inhibitors, these topoisomerases are involved in DNA replication. So again, it's going to interfere with that process. Okay, so based on what we talked about with the cell cycle, it makes sense that this is how chemotherapy drugs work. Hopefully it makes sense. There are other types of biologic and more targeted therapy. There is definitely a push towards this personalized medicine, right, where we're using, you know, we're understanding a person's genetic makeup and also the genetics or the sort of the genetics of that actual cancer that they have, and trying to develop specific treatments to treat specific cancers rather than this sort of one size fits all for all cancers. These guys, the biologic therapies, will not work like chemotherapy like we talked about before, but a little bit different, right? So it says these will enhance the body, the ability of the body to fight cancer. So we said the immune system itself should recognize these cancer cells and get rid of them. Okay, and so these biologic therapies will essentially enhance that, right? And so they're going to target the immune system to be able to fight off these cancer cells more efficiently, right? And so that's how they work. Again, chemotherapies are interfering with the cell cycle, stopping these rapidly dividing cells. These biologic therapies are targeting the immune system to make it work better, to get rid of the cancer cells that are there. So your own body is getting rid of them. There's not a chemical agent that's killing them. Okay, and so that's what this is telling you here. Okay, so it increases the cell numbers of specialized white blood cells so that they can basically phagocytize those cancer cells and get rid of them. Okay, let's see what this guy is. So it says targeted therapies target the hallmarks of cancer growth with less toxicity. Oh my goodness. Right? Then chemotherapy, because we told you that chemotherapy, or I told you that chemotherapy can affect other normal cells as well. Here, you're not really doing anything like that. You're just stimulating the immune system to work better to get rid of these cancer cells. So you really should understand the difference between these biologic therapies versus chemotherapy drugs. Okay? All right, so this targeted therapy is here, kind of different than these biologic therapies. It's trying to target specific aspects of metastasis and sort of cancer cell growth, right? Like angiogenesis and things like that. Okay, so it's a more targeted approach rather than just killing rapidly dividing cells. There's it's kind of just a more specific approach. Okay. Gene therapy, I already said this, right? Really, this is kind of where the sort of new, I guess, sort of face of cancer treatment is kind of to understand that and develop these personalized treatments. Here, there's also, you know, some clinical trials where you're modifying genes, right? So that's what this is saying here. Most commonly, a normal gene is inserted. And so we'll see how far this goes, but this is actually modifying genes or replacing, you know, dysfunctional genes with ones that are normal. Okay, so that's what this is saying here. Stem cell transplantation. You can basically get first chemotherapy, and then, right. So initially, clients receive chemotherapy and a growth factor to cause these, you know, blood stem cells to be released from the bone marrow into the peripheral circulation, and then basically you can identify these white blood cells and then collect them for future use. once the clients then receive high dose of chemotherapy, right, total body radiation, to basically get rid of all of these rapidly dividing cells, those stem cells can then be re-infused into the body. So first you're harvesting these blood stem cells from that same patient, right? Then you're basically getting rid of all the bad cells that you got, all those cancer cells, and you're re-infusing the body with these stem cells. All right, and that's basically it. So sorry for sort of stumbling a little bit here, but again, you know, this is, as you can tell, this is probably going to be only used for really serious cases and in only certain types of cancers. Okay. All right, so that's it for chapter 12.